On the 3rd week of gestation, the embryo undergoes gastrulation and forms a trilaminar disc which contains the ectoderm, mesoderm, and endoderm. And then later on, ectoderm will differentiate into neuroectoderm, which invaginates on itself and forms the neural tube. So the anterior opening is also referred to as rostral or anterior neuropore, and the posterior opening is referred to as posterior or caudal neuropore. Now, failure of the closure of the anterior neuropore can cause anencephaly, where the forebrain in this fetus will be missing, and thus consequently, due to the lack of forebrain, there is a frog-like appearance to the fetus. So this is what I'm talking about. So as you can see, the forebrain is missing in this fetus, and there's a frog-like appearance to the face. In addition, since the swallowing center is missing, they cannot swallow the amniotic fluid, and thus there would be polyhydramnios, which means that there is too much volume of the amniotic fluid. Now, in addition, defects can arise from failure of the posterior neuropore to close, and these include spina bifida, where the vertebra is missing, and over the defect, a tuft of hair will grow. Meningocele is the condition where the meninges will herniate through the defect, and meningomyelocele is the condition where the spinal cord herniates through the defects. Now, common causes of neural tube defect include folate deficiency, and folate is vitamin B9. So therefore, it's recommended for females of reproductive age to take folate supplements. Alternatively, medications such as methotrexate and trimethoprim, which are folate antagonists, can cause neural tube defects. Anti-seizure medications such as valproic acid and carbamazepine, both of which interfere with intestinal absorption of the folate and can cause neural tube defects. I would also like you to know that uncontrolled diabetes, particularly diabetes mellitus type 1, is associated with neural tube defects and anencephaly. So just keep that in mind, that folate deficiency or uncontrolled blood sugar associated with diabetes can cause neural tube defects. So the test that can be used to screen for neural tube defects is alpha-fetoprotein, and you can check that either in maternal serum or amniotic fluid. And if the results are positive, then you can use a confirmatory test by checking the levels of acetylcholinesterase in the amniotic fluid. Now, one question that you may be asked is, what should you do if the levels of alpha-fetoprotein is initially high? So, as you can see, this table shows you that the levels of alpha-fetoprotein will initially rise in both amniotic fluid and the maternal serum, and then later on they decline. It's at around 18 weeks of gestation that mothers are checked for the levels of alpha-fetoprotein in the serum. And you will have to refer to this chart to find out very exactly how much you're expecting to find in the maternal serum at around 18 weeks gestation. So let's say, for argument's sake, that we have a fetus that have too much alpha-fetoprotein in the maternal serum. So what would be the next step? And the first step is to repeat the test. So it's very likely that there is an error during lab studies, and usually 30% of these tests will come back normal in the next study. So the first step is to repeat the test. And then the second step, if the repeat is again abnormal, is to do the ultrasound study. An ultrasound study is for two purposes. One is to find the age of the fetus. And so here we are assuming that the age of the fetus is 18 weeks gestation. But what if the age of the fetus is wrong and it's like 22 weeks gestation? Then the amount of alpha-fetoprotein that is found in maternal serum would be correct. So the first step is to confirm the age of the fetus. And second is to visualize the spinal cord and the brain for any defects. So visualize defects. So once again, if there is too much alpha-fetal protein, you shouldn't right away conclude that there is a neural tube defect. You should first repeat the test, and if the results came back abnormal again, then you have to use ultrasound studies to check the age of the fetus, and then if possible, visualize the defects directly. And that concludes our discussion.